In this video, I'm going to talk about the common cold, a frequent cause of runny noses, sore throats and coughs. It's often mistakenly referred to as the flu, but the common cold is a separate illness, often termed an upper respiratory tract infection. I'll cover how long the illness typically lasts, how to manage the symptoms, and when to seek advice from a healthcare professional. A common cold is a very common self-limiting viral illness affecting the upper respiratory tract, including the nose, sinuses and throat. Symptoms usually last from a few days to up to 3 weeks. There are many different viruses that can cause it, but regardless of which one is involved, the management is the same. People of all ages get colds, but children under 5 are more prone. Adults typically have 2 to 3 colds a year, but children may have up to 8 annually. The virus infects the lining of the upper airways, causing inflammation, swelling and mucus production, leading to the typical symptoms: a runny or blocked nose, sneezing, sore throat, a hoarse voice, cough, and a fever or high temperature, which is more common in children. Symptoms peak within 2 to 3 days, then improve, usually lasting 1 week for adults and older children, and up to 14 days in younger children and infants. A mild cough, though, can sometimes last up to 3 weeks. Colds are self-limiting illnesses, meaning that they resolve on their own. There is no specific treatment to speed up recovery, so we focus on managing the symptoms. Rest. Get plenty of sleep and avoid overexertion. Stay well hydrated. That means drinking lots of fluids to avoid dehydration. For symptom relief, use paracetamol or ibuprofen for the fever, headaches or muscle aches. Vapor rubs and nasal saline drops can help reduce nasal congestion, particularly in young children. And warm drinks with honey and lemon can soothe a sore throat and irritating cough. We definitely do not recommend antibiotics for common colds because they don't work on viruses. They can cause unwanted side effects, and when used unnecessarily can lead to antibiotic-resistant bacteria growing in your body. The common cold usually resolves on its own, but you should speak to a healthcare professional if symptoms are worsening after 5 days or they haven't improved after 2 weeks. There's a severe cough producing thick or bloody phlegm, shortness of breath, chest pain or wheezing. For young children, seek help if they are not feeding, show signs of dehydration, or if the high temperature persists after 5 days. It's hard to avoid spreading colds, but covering your mouth when coughing or sneezing, discarding tissues immediately, and washing your hands regularly can help reduce transmission. Avoid close contact and sharing personal items like towels. I hope this video has clarified what a common cold is, how to manage it, and when to seek professional advice. Do remember, most colds resolve on their own without any long-term effects. For more information, visit the NHS website or speak to a pharmacist. If you think your symptoms don't fit a typical cold, please contact the GP surgery or 111.